And thank you all for being here, and I'm very excited to share with you my journey, indeed, to develop the Tovertafel, and I will tell you all about it. Yes. So, empathy, I'm sure most of you will know someone that is living with dementia, and I think there's the vision of someone sitting still, almost like closed off from the world around them, is such a prominent thing that we see in care for people with dementia. And I'm talking for people in the later stages of the disease living in care home facilities. 90% of people that live with dementia suffer from this apathetic behavior. And you can imagine sitting still all day that it makes your muscles stiff and your joints, but it's also boring and maybe even lonely. And even your cognition, the deterioration goes even faster when you sit still most of the day. Our design vision for the Tovertafel is to actually look at the entire journey of dementia. And we made this little graph to show you that the quality of life is as we know it. And somewhere in that journey, in the beginning, your quality of life is compromised because you start experiencing loss of memory, but you also start losing grip of life. You start maybe being confused about time, and you're not sure who that person is that is also sitting in your kitchen table in the morning. And when that quality of life is like sort of compromised, we would like to develop products that contribute, that fill a little bit of this gap. And we would like to, in the future, develop more products actually along that whole journey of dementia that could almost be a red thread, like something to hold on to, and actually during the journey improve that quality of life day by day. This is a product, the Tovertafel, and it is a series of games to stimulate people with dementia for being more active. And it's all about creating meaningful moments for the nursing home residents in interaction with their carers, but also family members that come and visit. And I'll tell you a bit about how we got to the product and how we got to this design. But first, I would like to show it, because I can tell you, actually I can tell a lot longer about it than 20 minutes, but I think it is more impactful if I show you what it does and what we see happening in care homes where we install the product. Once is enough. Okay, so how we got there, just to set the scene a little bit. So about 11 years ago, I started my PhD research. And my mission was to motivate people in later stages of dementia for physical activity and social interaction, to challenge that apathy that I told you about. It was indeed from industrial design engineering and the VU University of Amsterdam. About 5 years later, we launched a product, and I also chose to first launch a product to have tried to create that impact that we were after before finishing my dissertation. That was 2 years later, but luckily I did it. And where we stand now is that over 4,000 Tovertafels in care and education are being used on a daily basis. My research started as actually like most design projects. So firstly, I looked at the environment of care home residents and how the impact is on physical activity. So first I looked with a systematic literature review to the physical elements in the environment. So you must think of lighting, the building footprint, sounds, like how do these elements in the physical environment impact how alert, how active people are, or how independent people are within the care home environment. I also looked with qualitative studies to the social environment and what that does. So the interaction between residents. What role does a carer play in someone's level of activity during the day, and how does the family impact their level of activity, the freedom maybe even to use? And these were all very interesting elements, very important impact to my design studies. The third study that I did was literature-based, and what we did, we looked at all the play experiences from game literature. So these, you see a few here, so competition, captivation, challenge, everything that we experience while playing games or while playing. And I compared that with the neuropathology of Alzheimer's disease. So how does the brain, which areas in the brain are still intact and which ones are affected by the disease in different stages of dementia? And what was very important to understand is that someone in the earliest stages of the disease, it has a completely different brain than people in the very last. So one of my conclusions was in the last stages, so in GIES 6 and 7, if you are aware of that scale, is that there's only 3 play experiences that are still left, that are still capable of experiencing, and that is sensory stimulation, relaxation, and reminiscence. So also that's what the only play experience that I had to develop products and to develop games for them. I did choose because I also realized that I had to make a decision. Okay, am I focusing on people in the earlier stages, or somewhere in the middle, or somewhere in the end? But my reason to choose for people in late stage dementia is that they are the least active. There's also hardly any product that is developed for the general public that is suitable for their level of disease, their brain capacity. And I thought it was the biggest design challenge. So I had only these 3 play experiences and all the knowledge that I had about the environment that I could design a playful product in the context of the nursing home environment. I used co-design methods to design my product. So I had an initial idea, I tried it, we experimented a lot with it. Something completely different happened. So while sort of interacting with nursing home residents, we came to the initial 6 games of the product. During my study, my last phase was a small-scale intervention study to challenge also the effects of the games. Are we capable with a product to reduce that appetite, to stimulate them for some interaction, physical, social, or cognitive activities? Nowadays, we did a lot more research because it's still one of our most important pillars of the company. So you see here a few more studies, and we also look at a more widespread number of effects, because I think the product can do a lot more than the initial focus that I had during my PhD. I see that we're already halfway time, so I'll go quickly, but we have proven to reduce apathy, reduce restless, intense behavior, negative effects, and most importantly, especially in this talk, is improve quality of life. We use the QualiDem tool, and already in different studies, quite a few studies, we have shown that we can indeed increase a bit of that experience during the day, the joy of life. I think that it was what we are all after. We've also seen that we have effects on carers and on family members. And later quite a few years after my PhD, we also started to look at, hey, how do we influence the whole care ecosystem within dementia care? And by knowing what the potential effects are, we can also develop the products further and further and develop certain interaction or certain games that hopefully make that impact even stronger. So at GIES, we are very much focused on their experience of work, the work burden, the enjoyment in work, and obviously the relationship with the client. But also family members. It is challenging to have someone with dementia in a care home. So to help them having something to do, having a beautiful moment, and help them most facilitate the interactions, the conversation that they used to have with their loved ones. And as I said, still now, after 5-6 years after my PhD, the research, the co-design, and the development of the product is still exactly the same how I did that the first time round. So my entire company is actually based on this way of working. What has changed is that my perception of my perspective on the impact of the product. And I would like to share that with you because I'm also curious what you think of it. So when I started my project, you can also read it in the goal of my PhD is to motivate people with dementia to become more active, obviously to contribute to quality of life. So that is what I did in that mindset, I did my research, I developed the product, and that's also the intervention studies. I actually asked the carers to move out of the room, to not interfere with my research data. And what has changed is that when we launched the product 5 years later, we saw that the impact was a lot broader. So what we got back is that actually already very much in the beginning, that carers also gave us feedback on how it impacts them as a carer and how it impacts their relationship with the residents, how it impacts their experience in work. So we also started to do several creative sessions and evaluation studies, as I mentioned earlier, with carers, how the product could support them in providing the best possible care. And not only carers, but important is also family members that come and visit. And I always like this picture because we all know that kids can bring in so much energy. And I hope you have seen in the movie that the platform, so the interactive games, are so appealing to especially to children. So it's a product that is initially designed for this very last phase of dementia, people at age. And when young children come in, they've got something to do. They've got something to talk about, laugh about, and both for the kids, it's a completely different experience to visit grandmother or great grandmother in the care home, but also for the residents, they have really a lot of enjoyment in bringing that young energy into to the care home. And today, my perspective is maybe changing again, and I would like to share you my moonshot, maybe my personal one. So what I feel is that our perception of dementia or Alzheimer's is negative, is fairly frightful. If you ask people, what is your worst nightmare? Often it is to have dementia, lose your memory, lose grip on life, lose your relationship with your loved ones and move to a care home. But we also know that your fears obviously influence your experience, and maybe also the ones of your family members, or the experience of your family, of you going into a journey of people with dementia around you. So what I think is that with the right environment and maybe the right products, or for example, care homes or the people around them, is it possible to change a little bit of that perception of dementia? Can we make it less scary, or can we make it less frightful to going into that route? And what do we need for that? How can we change our focus from the negative and the agony? That is definitely there, but how can we change the focus on that to the things that we still have and that we can still achieve or create with people that are living with dementia? Because, and I'm not talking about people with early onset dementia, because they are in the midst of their lives, and that is for me, a completely different situation. But if actually my grandma at the moment, she turned 97 4 days ago, and I visited her yesterday, and that was the first time that she had absolutely no clue who I was. And you'd maybe expect that I was very sad, but I realized that I wasn't, because she has a beautiful age, and the moment I spent about an hour with her, and I served her meal, and we had so much fun. We had so much laughter. She grabbed my hand, she made contact, and we very much focused on what was there. We repeated one line, I think, about 60 times, but in the process, completely going with her in her conversation, we actually had a very beautiful hour. And I know as a fact that hour was filled with tons of moments of happiness. So, and I'm grateful that I've had this moment with my gran. And I think in a way I'm sure you are aware of the development of the brain of a child is roughly the reverse of the deterioration when you have Alzheimer's. So isn't it slowly but surely letting go of life? Can we see it as maybe fulfilling life, or fulfilling the circle of life? And that comes down to looking after them, creating the right environment, understanding how you can facilitate a meaningful moment, a conversation, and acceptance. But the acceptance can only be there if their quality of life is looked after, if we know that where they live is a beautiful place, if the people that work there have enough time and enough attention to every one of them, and that what they do during the day is fun and pleasant, and that they pass time in one, exciting is maybe big, but in a pleasant way. So can we create that with all of us? And that's, I think, where we need to collaborate. So you cannot do it on your own. I cannot do it on my own. We need obviously the professionals in care, because they know best, but we also need the creative industry to support them. We need family members to understand what someone in specific need, what his or she's preferences are, interests are, where someone is proud of. And I think if we create an environment, and that's both care and a physical environment, that suits them at every single step along the dementia journey, I hope that their experience, but also the experience of family members, becomes more positive, more beautiful, and more meaningful. Thank you very much.
I begin by formally acknowledging the traditional custodians of the lands on which we're meeting today, and pay my respects to their elders past and present. My thanks to the Hong Kong Special Administrative Region Government and Hong Kong Council of Social Service for inviting me to speak with you today, and to everyone who's taken the time to join. I'm delighted to be here. Welcome. Today, I'm going to share about a range of innovative technology we've made available to educate and support people living with dementia, their carers, and their families, that's been developed by Dementia Australia. And please note that the data I refer to in my presentation refers only to Australia. To begin, I'd just like to give you some background about Dementia Australia and the scale of dementia in Australia. So Dementia Australia exists to support and empower the estimated 500,000 Australians living with dementia and almost 1.6 million people involved in their care. Founded by carers more than 35 years ago, today we are the national peak body for people impacted by dementia in Australia. Dementia Australia is the source of trusted information, education and support services, and we advocate for positive change for people living with dementia, their families and their carers, and support vital research. And we're here to support people impacted by dementia and to enable them to live as well as possible. As you know, people living with dementia are some of the most vulnerable people in our community right now, and depending on their symptoms and their level of ability, they may have varying levels of understanding about the changing situation with COVID-19. And ramping up the focus on engagement and communication at this time of restricted physical contact is vital for everyone, and especially for people living with dementia. If stimulus is reduced for people living with dementia, the loss of cognitive function can escalate. And over time, these are losses that most people living with dementia may not be able to regain. And certainly that's what the research is showing. Dementia prevalence in residential aged care in Australia is significant, and recent data suggests that just over 2/3 of all people living in residential care right now have moderate to severe cognitive impairment. And around 70% of people living with dementia in Australia live in the community. The impact of COVID-19 has certainly exacerbated some of the existing challenges in our aged care system, including the capacity and availability of the workforce and the challenge of balancing the individual care and wellbeing needs of residents with the safety of everyone living and working in the service. In order to improve the quality of care at a minimum, we need our aged care workforce to understand dementia. And traditional education was delivering improvements in knowledge, but not necessarily changing attitudes and behaviours, which is necessary for cultural change and improvement in care and practice. So what Dementia Australia has been advocating for is a cohesive, structured and integrated national approach to dementia training and education. Building on over 30 years of experience, Dementia Australia established the Centre for Dementia Learning in 2017, and we did that to transform dementia practice through programs that are informed by research and what people living with dementia share with us. We're always striving to create learning experiences that touch, move and inspire participants to change the way that they work and to really inform a more dementia-friendly and person-centred way of caring for people living with dementia. Now, there was already quite a bit happening in areas like health and defence around the use of simulation to promote learning, and we started to explore how we might use technology and computer gaming technology specifically to create a unique learning experience which provides participants with an insight into what it might be like to live with dementia. And what we hypothesised was that if we could actually simulate for people the experience of what it's like to have dementia, we would change attitudes, which would change behaviour, which would change practice and improve the quality of care and life for people living with dementia. So in response to COVID-19, we've developed we've also developed virtual classroom education for aged care workers. And what that does is equip staff with strategies and skills to be able to provide quality care for people living with dementia. And these, of course, are accessible from anywhere in Australia. One of the areas that we developed recently is our Enabling Eddie immersive workshop. And what that does is it enables people to see the world through the eyes of the person living with dementia. And we use high quality virtual reality technology to achieve that. Now, Eddie stands for the Educational Dementia Immersive Experience, and it's also the name of the man living with dementia. And we've used an app, and it runs on a smartphone. It can be played through a Samsung Gear virtual reality headset. And this innovative workshop has now been expanded globally, making a difference in Canada, Singapore, the Czech Republic, Germany, Austria, and Switzerland. Now, when a user first puts on Eddie, they step into the world of the man called Eddie, who lives at home with his wife, and Eddie is living with dementia. What they see is what Eddie sees, what he hears, and how he experiences the world, similar to how a person living with dementia does. Now, the problem that we're trying to solve by using virtual reality game technology is one of perception. And people living with dementia can sometimes perceive the world differently due to a physical change that's happening in their brain. For example, patterns on carpet might occur as they can occur as bugs. It might be that they see snakes as a pattern. A dark corner might appear to hold unknown dangers, or shiny objects on a floor can occur to the person living with dementia as wet and to be avoided. Now, virtual reality technology allows us to give the user such an extraordinary experience of the world that people living with dementia live in. I'm now going to play a short clip, and that'll give you an insight into what Eddie's seeing. Oh. Now, what you can see from that is the experience really is designed to build empathy in the user for people living with dementia. And what it allows for is for people to get access to that world. And it's often a world that people living with dementia can't explain, but it provides a powerful insight into the experience of a person living with dementia. Now, last year, we delivered an Enabling Eddie session to care staff at a residential home, and the feedback at the time was amazing. But it wasn't until 2 weeks later, when our team went back and saw them again for another session, that the real impact of the session became clear. Now, the staff that attended the Enabling Eddie session was so impacted by what they saw during the simulation that they went to their manager and said, look, we need to make some changes around how we care for people. And together they worked in enabling those changes and setting up an environment that made a difference to the signage so that it could assist people living with dementia with wayfinding to toilets and to the dining area and lounge. And the other thing about that is it's not only good for people living with dementia, but good for people with visual perception disorders, so people who might be short-sighted, also for people with culturally and linguistically diverse backgrounds. They also put in individualised photos on residents' doors as opposed to having their names, and also new single-coloured tablecloths and crockery on tables for meal times, and that enabled people with dementia to see more clearly where their plates and cutlery were and facilitated their independence at mealtime. The other thing was that as a result of the changes, what staff noticed was such a reduction in challenging behaviours, and residents are more engaged, they're spending more time out of their room, and there's a decrease in sleep disturbance during the night, and staff are spending more time engaging with residents, which is so fantastic. So it's had such a positive impact on staff as well as on the quality of care and life for people living with dementia. The next I'd like to share with you is called the Virtual Forest, and this is an immersive sensory experience, and we designed this for people living with dementia specifically for them to have fun, to be an environment where with the changes that they made, with the wave of the hand, that they could have butterflies appear, and it really gave them a sense of enjoyment and control over the environment that they were in. Now, we launched this in 2014. It was certainly a leader in the field of gaming technology for people living with dementia, and it was before untethered headsets were widely available in Australia, and there was no other product like this in the world. It certainly attracted global media interest. There's been, since then, a lot of technology has evolved, but again, the sorts of feedback that we received from people in residential aged care, and we worked with a residential aged care provider to develop this from the prototype. And what they found was that it was so effective in reducing challenging behaviours, in people having a sense of control over their environment and being able to be with family members while they were using the technology and enjoy that with them. And they found as a byproduct that their loved one living with dementia started to share about previous memories of being in similar situations. So what we used for this is the virtual world of forest. It gives control back to the person. An Xbox sensors used to detect the movements of the user, and that allows them to interact with the forest. And the sensor detects simple actions such as a clap or waving of the hands, and that allows the user to control the amazing scenes that are there and animals appearing as well. It also uses video game technology as both a point of interaction with software and a point of immersion for the person living with dementia experiencing the forest. And it's a deliberately personal experience, but one, as I mentioned earlier, that can be shared with their loved ones or carers. And residents and staff at LifeView Residential Care played a critical role in testing and refining the product over 2 years, and the thoughts, reactions and the mood of residents formed valuable feedback on this project, and it really is built around the sensitivities of those living with dementia. The next piece of technology that I'd like to share with you is called A Better Visit. And Dementia Australia developed this app in November 2018, and it's a free tablet app that assists families and loved ones in connecting and communicating when visiting their family member in residential care. And really, it's designed to be interactive, it's stimulating, it's fun, and certainly it includes music, simple games such as noughts and crosses, Go Fish, and images of iconic Australian locations. Now, we developed this app after feedback from family members that they were having difficulty when they were visiting their loved one, not knowing what to do or how to communicate, and they were wanting their visits to be more meaningful, to be more engaging, and to be something that both parties enjoyed. And certainly with the feedback that we've had about the app is that that's exactly what happens. Now, over time, social isolation can have a profound impact on the person living with dementia and primary carers, and we know that that's certainly been one of the challenges that we've experienced over the lockdown period and extended lockdown periods that we've had in Australia. And certainly the Better Visit app, by playing games in the app with carers and other family members, it inspires them to really engage with the person with dementia through the interaction, the images and the sounds, and bring back lovely memories for them, and really facilitates discussion and enjoyment. The next piece of technology is called A Day in the Life, and it's a mealtime experience. And what makes this piece of technology so different is that you actually get to experience this from the world of the carer and also through the eyes of the person living with dementia. And one of the challenges in residential aged care in Australia is around poor nutritional status. And we know that that's been well described with people living with dementia, and the evidence and association between dementia, weight loss and malnutrition is compelling. Now, using virtual reality and the avatar technology, what the workshop explores is the multifactorial influence of food and meal times on quality of life for people living with dementia. And participants explore the strategies for improving mealtime and nutritional outcomes. I'm just going to show you a short clip.
Ted and Mary.
Priya, Ted's a fee.
Yeah, sure. No worries. Ted, I want you to have a go. It's all set. Okay?
Okay, I'm not sure what happened there. Let me just see if I can get it. No, I can't. Okay, so we have a technological glitch in the technological component of the talk, but what this is designed to do is to give you a view of the world from both parties. And I think that's really important because carers at times in residential care and also in home care are faced with the challenge of multitasking and trying to keep their attention on the person that they're caring for when all of these other activities are going on around them. And it really does demonstrate the challenge from both sides. And I think what this gives to people is a real shift in attitude and compassion for not just the person living with dementia, but also the carers and all of the things that they're required to do in a shift that unfortunately sometimes compromises the quality of care that people receive. The team is also working on a number of other technological applications for the launch in the near future, so do stay tuned. And one involves an interactive and immersive digital learning platform for aged care and for aged care workers, and Ted the Avatar, an interactive character that will enable aged care workers to communicate and engage with him directly. Traditional education for aged care workers usually involves a classroom scenario with a facilitator, PowerPoints and a group discussion, and participants are told about and discuss the principles of good communication. But with Ted the Avatar, rather than telling care workers what good principles are for a person living with dementia, they actually get to experience these. And I think that in a really safe environment absolutely inspires them to start to look differently and view differently the way that they communicate. So Dementia Australia and Deakin University's Applied Artificial Intelligence Institute was jointly awarded the Victorian Eye Awards recently for Ted the Avatar, so we're very excited about that. And certainly the key to transforming dementia practice is about engaging with the person, strong leadership, quality learning experiences, ongoing mentoring and coaching of staff, which I cannot overemphasize, and setting a gold standard for dementia care that is consumer and outcome focused rather than process focused. So I think at the heart of these programs and the work of the Centre for Dementia Learning is being able to engage, enable and empower participants to develop real insight into what it's like to live with dementia and to be able to inspire people to change their attitudes and behaviours to transform their practice. So certainly the engagement of people living with dementia is essential in the journey to transform dementia care practice and improve the quality of care and life for people living with dementia, their families and their carers. Thank you so much.
Hello, I'm very pleased to be chatting with you this afternoon and to talk about Mindful Garden. Before we do, I'd just like to tell you a little bit about our research team, which includes the people you see on the screen. Some of them are students. One of them is a medical doctor, and we work together very closely in doing a feasibility study of Mindful Garden, which has been amongst some of the most interesting work I've done in my career. I'd like to acknowledge right at the beginning the people who have provided funding, the Center for Aging and Brain Health Innovation, as well as the AgeWell Network, which it stands for Aging Gracefully Across Environments, Using Technology to Support Wellness, Engagement, and Long Life. It's Canada's technology network. I need to disclose that I have acted as in my introduction, as an advisor to Mindful Garden, but And also, I have been compensated for some of the work that I've done through the grants that were given to the Delta View Care Center, which is the location where most of the work that I'm going to talk about today was done. The theme of this workshop is technology to improve the quality of life for people living with dementia. Most of my talk will focus on Mindful Garden as a potential tool for calming long-term care home residents with dementia, who in my country are the people who make up most of those who are in residential care. So, approximately 85% of people that are in long-term care in Canada would be people with dementia sufficient that they cannot be managed in the community. So I'm going to talk about how Mindful Garden can be used for the treatment of hyperactive dementia in a long-term care setting. I'm also going to speak about another application of Mindful Garden, and that is for the prevention of delirium in ICU students. The studies on the ICU use of Mindful Garden have not begun yet, but they will be shortly starting, and they are being conducted by a different research team led by Dr. Reynolds, who's also from Simon Fraser University. I want to begin by telling you about Mindful Garden. We call it an interactive digital behavior modification technology. And the model that we used in the long-term care studies looks like a television set on wheels. And as you'll see that in the next slide. But what you need to know about it is that it's a combination of hardware, a mini PC, and the kind of software that is used in video games. So that gives you a better idea of what it looks like. It has, so you can see it has a webcam. It has the mini, there's the mini PC you can see. And in order to meet hospital requirements for infection control, and so it can be wiped down after use, the mini PC and the related hardware are contained in an industrial-grade enclosure that's at the back of the screen. The way it works is that vocalizations or movements by the person in front of the screen will trigger a calming garden display. So what you will see are blossoming flowers and butterflies, and it's very relaxing. I know when I first saw it, I was quite intrigued by it. I had a very difficult day. I'd had a hard time getting to my meeting on time. And you sit and you watch this, and it's really quite relaxing. And it's designed to arrest, to de-escalate anxiety, aggression, other kinds of disruptive behaviors. So this gives you an idea of what it looks like. And the screen goes dark in the evening. In the daytime, it's brighter in the background. Now, in addition to registering motion and vocalization, it has the potential to receive information from sensors that would monitor vital signs like heart rate and blood pressure. Those are the kinds of clinically accepted indicators of anxiety or disruptive behavior. And what Mindful Garden does is to compare the inputs with some baseline readings, and when there's a significant change, there's an algorithm that increases or decreases the speed of the movement on the screen. There are a group of patients with generalized anxiety disorders who are currently trialing wearable sensors that track heart rate variability, and inputs from the sensors are pushed to the Mindful Garden over Bluetooth, the wireless technology used for exchanging digital data over short distances. And where there's a significant increase or decrease in vital signs, the idea is that the algorithm in the computer will change the velocity of the visualizations that are on the screen. About the research, following a proof of concept that we did in a hospital setting, my research team has done 3 feasibility studies in a long-term care home. And our focus has been on reducing behavioral and psychological symptoms of dementia. The eligibility to take part in this study was that the resident had a diagnosis of dementia and was reported by the care staff as exhibiting behavioral and psychological symptoms. So disruptive behaviors, and the goal of our study was to get a preliminary indication. So this is feasibility. So it's a first set of studies on this device, but to get an idea of whether it would do what it's supposed to do, which is to distract, to calm residents with hyperactive dementia. So the specific objective of the research was to see if this device, exposure to this device would reduce the number of behaviors that the person was exhibiting. And in the case of our personal care and bathing studies, the time that was required to provide care. Just to give you a little background, in Canada, over 500,000 people live with dementia. The number is expected to double in the coming 10 years. There's approximately 76,000 new cases of dementia diagnosed every year. And as the previous speakers have said, and as any of you who work with people with dementia know, it's a major cause of dependency and disability, and it doesn't just impact the individual, it impacts those who are caring for them, whether they're informal caregivers or formal caregivers. And we need to be concerned about the quality of life, both of the person with dementia and with the carers, the quality of their life. So when we talk about behavioral and psychological symptoms of dementia, you'll see on the screen a number of the component parts, the kinds of behaviors that are exhibited, and amongst the most common and one that gives some of the most problems, both for the person and for the caregiver, is agitation, which presents as restlessness, pacing, arguing, complaining, resistance to care. But this slide shows that there are a range of different kind of symptoms that we're talking about here, and you can group them into 4 broad categories along the 2 dimensions of whether they are aggressive or non-aggressive, or physical or verbal. So just to give you an idea of the size of the problem that we're talking about is in a systematic review, what they found was that the median prevalence of BPSDs in a long-term care setting was 78%, and nearly every dementia patient at one time or another in the course of their disease is going to exhibit these. So it's associated with higher care burdens, with costs and lower quality of life, both of the residents and the care staff. So if we can find a way of dealing with these in a non-invasive manner, and where we don't have to use drugs, because the drugs have negative effects. And we know that with people with dementia, react poorly to a number of the psychotropic drugs that are sometimes used to control behavior, that are used too often, or the alternative is physical restraints. So the objective in our studies was one of the studies had to do with personal care, morning and bedtime care, because we had asked in the care facility, what are the times that are most difficult for you? And what they said, the staff told us, was in the morning getting people up, and in the evening putting them to bed, and when they had to do the personal care of dressing, undressing. Bathing is another problematic time. And then the third setting for our studies was in public space, where people are grouped in a lounge or whether they're in a dining room and they're together. And again, if somebody is acting out, it's disruptive to the other residents. So in our personal care study, the participants were 13 people, aged between 74 and 100, and they were randomly assigned to a control or to the intervention group. And the people were observed for 3 days. And on the first 3 days, they received usual care. The intervention received usual care plus exposure to mindful garden, while the controls received usual care only. On day 4, both groups were exposed to mindful garden with verbal prompting. And when we talk about verbal prompting, what we're saying is that we draw their attention to the screen so that they will look at it and be able to benefit from its calming effect. The groups were compared on the frequency and the type of BPSD they exhibited, and on staff time to complete care. Our data were collected the old-fashioned way using the 26-item checklist that we had developed for a previous study. And this shows the results. If you look at the yellow lines and you compare the intervention and the control, what you see is that for morning care, the exposure to mindful garden tended to reduce the number of behaviors, problem behaviors that they were showing, and it also tended to reduce the amount of time it took the care aides to do their work and get people up and dressed and off into breakfast. For some reason, which we still don't know, the device doesn't seem to have as much effect or impact at night. The bathing study was one at the care home where the study took place. Some of the residents received tub baths and others are showered in the bathroom attached to their private bedrooms. Early on in the study, we determined that it was not possible to use mindful garden in the bathtub setting. One of the reasons was because if you position it at the side of the tub, it makes it very difficult for the staff to do their work. A second reason was that we noticed that people, when they're in a bathtub, tend to keep their eyes down and to throughout the bath. So we therefore decided, let's try it in the setting of their ensuite bathroom where they tend to be showered. And so that's what we did. And what we found was that there seemed to be a quite interesting finding. We saw that there was a reduction in the number of BPSDs and in bathing duration. It's not a big effect, but there is some effect. The third study, as I said, was the public space study. And in this case, what we were interested in was the behavior of people when they're with others in a common area of the building. And so we observed them from the time that they left their bedroom in the morning until they were put to bed in the evening. So on average, these people were observed for 8 to 10 hours on day one to get a baseline on the frequency and pattern of BPSD. Because if you go into the literature, you'll find there actually is not a lot of information about these behaviors. People talk about them as being problematic, but the question is how often and how many behaviors does the average person show? You know, we said that most people experience them, but for most people, most of the time, they're sitting quietly. And so it took quite a while for our for the study to take place, because what we did was to say to staff, you tell us when we should expose people to this device and see. We used it like a crash cart. And again, this was one that what we found was about half of the people that we watched actually did show behaviors, problem behaviors, and the impact of exposure was mixed. That it worked for some people, it didn't work for everybody, but the idea is still that, you know, you want to try to use non-pharmacological interventions, and there are trends that we saw in the data that suggest that this is a promising device to look at. We have questions that remain, such as why didn't it work in the evening? We have questions such as, you know, we used it as a crash cart in the public spaces. Would it be better to take people to the device than to bring the device to them? And then there's the whole issue of getting their attention so that they will look at the device and be able to benefit from it. The second study that I mentioned that Dr. Reynolds will be doing will test its effectiveness in reducing the use of antipsychotics and sedative medications and restraints in an ICU situation. And there, the focus is on management of hyperactive delirium. And the people will be exposed to 4 hours with standard care, and they will be compared with controls who get standard care only. So we're comparing those exposed to Mindful Garden with those who get just the usual. And the device will be a bit smaller than the one that we used. But the application to delirium in the ICU context is particularly interesting at this point in time when we've got people suffering from COVID-19, and those that are in the most difficulty are being placed in ICU situation. So if we can help those people as well as older people with delirium, then this is a device well worth investing in and in doing some more studies. It's in a long-term care home setting. It offers a gentle, non-pharmacological solution to managing hyperactive dementia and improving the quality of life of residents and the staff who work with them. And so the second set of studies will indicate whether it's also effective in preventing and in treating delirium. So, we see this as a potential solution in the types of things that we can do to try to improve quality of life of people with suffering from this dreadful disease. And, our motto is that when anxiety is lowered, then we can deliver care more effectively, more efficiently, and in a way that will be beneficial both to the person with dementia and to the staff. Thank you.